name is Elijah Nathaniel Supes Anabain, and I'm going to talk about the introduction. Where first, the elbow is where the distal humerus and the proximal ulna and also the radius are articulated. In other words, the upper arm and the forearm forming a joint that allows the forearm flexion, extension, and rotation. In this anatomical region, it is not only compromised of bones, but also there are ligaments, tendons, and also muscles that allow the elbow to have its own purpose. Therefore, it is important to understand the anatomy and the physiology of the elbow.
Hi, Assalamualaikum. My name is Ahmad Alif Aidi bin Muhammad Zamri, and my matric number is 2023 607 024. For this session, I will be describing about the anatomical and biomechanical perspective of the elbow. So, for this slide, if you can see the diagram that I attached in the slide, this is the diagram of the anatomical of elbow. So, this is the structure that I highlighted along the presentation. So, first of all, in the elbow, we have the lateral supracondylar ridge, radial fossa and lateral epicondyle, capitulum, head of radius, coronal process of the ulna, trochlea, medial epicondyle, and also coronal fossa. So this is the important or major structure that you should know in the elbow structure. Okay. For the first part, I will explain about the anatomical of perspective of the elbow. Okay, as you know, the elbow is a joint of a complex structure that will plays a crucial role in the upper extremity, which is mechanical linkage between the hand, wrist, and also shoulder. It consists of three articulations within its joint capsule, which is first of all the ulnar-humeral joint, radiocapitular joint, and also proximal radio-ulnar joint. Okay, these three articulations enable various movements like flexion, extension, supination, and also pronation of the forearm. The elbow's stability is maintained by an intricate interplay between this articulation and also the collateral ligaments, which providing a stable functional connection between the shoulder and also hand. It's important to understand the anatomy and biomechanics of the elbow because it is essential for surgical reconstruction and fracture fixation, as it allows surgeons to improve surgical outcomes. Okay. The elbow's anatomical includes key structure like the humeral ulnar joint, humeral radial joint, and also ligaments, which is we have medial collateral ligament, lateral collateral ligament, and annular ligament. Okay, for this part, I've explained about the three major joints that articulate with the elbow. First of all, for the ulnar humeral joint, it formed by the trochlea notch of the ulna and also the trochlea of the humerus, which allowing from the flexion and extension activity can be done by the forearm. Okay, next, which is the radiocapitular joint, which is formed by the head of the humerus. That be formed by the head of the radius and the capitulum of the humerus, which contributing to the flexion and extension. Okay, next, which is the proximal radio-ulnar joint, which is often considered a separate articulation that will allows for pronation and supination of the forearm. Okay, for the next part, we can see from the diagram that I had attached in the slide. Okay, we can see that the joint capsule is reinforced by the collateral ligaments on the medial and also the lateral side. Okay, the medial collateral ligament extends from the medial epicondyle to the coronal process and olecranon of the ulna, while the lateral collateral ligament originates from the lateral epicondyle and blends with the annular ligament of the radius. Okay, from this, we can highlight by the three major ligament, which is the medial collateral ligament, the ulnar collateral ligament and also the lateral collateral ligament. The medial collateral ligament, also known as the ulnar collateral ligament, extends from the medial epicondyte of the humerus to the coronal process and olecranon of the ulna. It consists of three parts, which is anterior, posterior, and transverse. While the lateral collateral ligament LCL originates from the lateral epicondyte of the humerus and blends with the annular ligament that encircles the head of the radius. The lateral collateral ligament also contributes to the stability of the elbow joint. Together with the medial collateral ligament and also lateral collateral ligament, it provides the valgus and varus stability to the elbow joint, and respectively they also allow for rotation of the forearm. Okay, for the next part, which is I will explain about the biomechanical perspective of the elbow. Okay, the elbow joint's biomechanics is complex, which involving the interaction of the humerus, radius, and also ulna, which allow positioning of the hand within a sphere defined by the shoulder movement and also the length of the arm. The biomechanics of the elbow can be divided into kinematics, stabilizing structures, and also force transmission. For the kinematic parts, which allow the elbow joints for flexion, extension, pronation, and also supination of the forearm. Okay, this for the normal range of the people, the motion for elbow flexion is 0 to 140 degrees, but most activities only require 30 to 130 degrees of flexion. Okay, for the part of stabilizing structure, primary stability is provided by the osseous and ligamentous anatomy. Okay, the radial head and also the coronal process are important as also stabilizers that will contribute to primary stabilizers of the elbow structure. The anterior part of the medial and also medial collateral ligament and also the lateral collateral ligament play as an important role as a ligamentous stabilizer, and the dynamic elbow stabilizer confers stability through the activation of various muscles that cross the elbow, which helping the resist of the valgus and also the varus force. For the final part, which is the force transmission, the elbow is a load-bearing joint with a biomechanical disadvantage due to the long level of the arm, with the force applied to the hand, and a relatively small joint surface area and short level arm for ligaments and muscle to counterbalance. Okay, the elbow can experience high loads during sports like weightlifting, gymnastics, and also racket sports like badminton and also tennis. In summary, the elbow's complex biomechanics involve the interaction of kinematics, stabilizing structure, and also force transmission, with allowing for a wide range of motion while maintaining stability during various activities.
Assalamualaikum, my name is Ahmad Asfar and I will continue with the attachment of the elbow. So, the elbow joint serves as a pivotal connection point between the upper arm and our forearm. It facilitating essential movements like bending, straightening, and rotating the arm. Its structure allows us to perform daily activities such as lifting, gripping, and reaching with precision and efficiency. So for the key structures, at the core of the elbow's attachment are three main bones: the humerus, radius, and ulna. These bones work in harmony to form a stable yet flexible joint that enables a wide range of motion. Surrounding these bones and ligaments, tendons, and muscles that provide additional support and control to the elbow. Next, we will discuss about the bones of the elbow. The elbow joint is formed by the articulation of three bones, which is humerus, radius, and ulna bone. So for the humerus is the upper arm bone that connects the shoulder to the elbow. Its distal end forms the humeral condyle, which articulates with the radius and ulna to create the elbow joint. The humerus provides a wide range of motion, allowing us to flex, extend, and rotate our arm. And next, for the radius is one of the two forearm bones. It's proximal and forms the radial head, which articulates with the humeral and ulna. The radius plays a crucial role in forearm rotation, allowing us to turn our palm upwards or downwards. And lastly, for the ulna bone, the ulna is the other forearm bone. It's proximal and forms the trochlea notch, which articulates with the humerus to form the elbow joint. The ulna provides additional stability to the elbow and forearm, especially during weight-bearing activities. In addition to the bones, the elbow joint is reinforced by a network of ligaments and tendons that will provide the stability and facilitate movements. For the first ligaments, which is the collateral ligament, the elbow joint is supported by two collateral ligaments, which is the medial collateral ligament (MCL) and the lateral collateral ligament (LCL). These ligaments run along the sides of the elbow joint, connecting the humerus to the radius and ulna. The medial and also the lateral collateral ligaments prevent excessive side-to-side movement of the elbow, ensuring stability during various activities. Next, we move on to the annular ligament. The annular ligament is a ring-shaped ligament that encircles the radial head, holding it in place against the ulna. This ligament allows for smooth rotation of the forearm during pronation and supination movements. Next, we go on to the tendons. The elbow joint is also reinforced by the tendons of the biceps and triceps muscle. The biceps tendon attached to the radial tuberosity, allowing the bicep muscle to flex the elbow and supinate the forearm. Meanwhile, the tricep tendons, on the other hand, attach to the olecranon process of the ulna, enabling the triceps muscle to extend the elbow and stabilize the joint during pushing actions. And for my last part, we're going to discuss about the muscles of the elbow. The elbow joint is controlled by a network of muscles that work in harmony to flex, extend, and rotate the forearm. For the first muscle type is the biceps brachii. The biceps brachii muscle, located on the front of the upper arm, plays a crucial role in elbow flexion and forearm supination. Its tendon attaches to the radial tuberosity, allowing the biceps muscle to generate the force needed for lifting and pulling movements. And the next one is triceps brachii. Opposing the biceps, the triceps brachii muscle is located on the back of the upper arm and is responsible for elbow extension. Its tendon attaches to the olecranon process also of the ulna, enabling the triceps muscle to straighten the arm and stabilize the elbow joint during pushing actions. For the other muscle is brachioradialis. The brachioradialis muscle, located on the forearm, assists in elbow flexion and forearm pronation. It also plays a role in various daily activities such as hammering, lifting, and also gripping objects. The brachioradialis muscle provides additional support and control to the elbow joint, contributing to overall arm strength and functionality. These muscles work synergistically to ensure smooth and coordinated movements of the elbow joint.
Assalamualaikum and hi. So my name is Muhammad Amal Mustaqim Zulkifli. I will explain about the functionality performance of the elbow. Okay, so how the elbow are well suited to perform its function. The elbow is a hinge joint, specifically a synovial hinge joint or diatrosis. As you guys know, we have many type of joint. For example, the pivot joint at the atlas cervical. We have hinge joint for the elbow. We have saddle joint. We have condyle joint, ball and socket joint at our head of femur. We also have the plain joint. So the elbow is one of the hinge joint. So it involves three bones. How the elbow is function? It involves three bones: the humerus in the upper arm and the radius ulna in the forearm. So this joint allow for flexion and extension of the arm as well as limited amount of the arm, which is primarily facilitated by the proximal radius ulnar joint. The elbow stability is maintained by various ligament and radial collateral ligament. Okay, so for the first functionality performance of elbow is flexion. So what is flexion? Flexion, elbow flexion is the term when we describing the movement of your forearm toward your body as it bend at the elbow. So the flexion is like this. Okay. So the inability to flex your elbow to the full extent that would like to is referred to impaired flexion. It could not be strong enough for you to do tasks like brushing your hair or putting food in your mouth. As you can get, as you guys know, the flexion we also use in our daily life, like when we want to go to the gym and we flex the dumbbell, or also when we want to eat. All this action in our daily life we need to perform this flexion. It is not always possible to flex it at all, but in our daily life all day we will perform this action. Okay, so we moving on to the next functionality performance of the elbow. The next one is extension. What is extension? So basically, the flexion is like this, but the extension is like this. Okay, the extension means the process of bringing the forearm back to its normal anatomical position from a flat posture involve increasing the elbow joint angle, which is known as extension. So the extension is involve the contraction of the tricep brachii muscle on the back of the upper arm. So extension of the arm play crucial role in our daily activities. For example, first one is the reaching and the grasping. So when we want to reach the object, extending the elbow allows the for reaching out the or grab object that further away, which is necessary for action like reaching for a height chef or passing something to someone. That's why we need to extend our elbow. Second one is the pushing movement. For example, when we doing push up, we need to push. We need to extend our elbow to perform a push up. So next one is sport and the physical activities. As you guys know, almost every sport we need to extend our hand. For example, if you play like badminton, when you want to smash, you need to extend your elbow to smash. The next one is for related work tasks. For example, when we want to move some object or in our workplace, we need to extend our elbow. The third functionality performance of the elbow is for pronation. The pronation is basically the rotating movement of the forearm that causes the palm to turn downward or backward. It's known as elbow pronation. So if you guys do your hand like this, when your palm is facing downward, it is called pronation. The pronator quadriceps and the pronator teres muscle help to promote this action. So the following are some real-world instances of the elbow pronation action. So when we will perform this pronation, actually in our daily life, we not really we not actually realize when we perform this pronation action. For example, the first one is turning the doorknobs. When we want to open the door, we turn the doorknob. We must perform the pronation. If we did not perform this pronation, how come we will open the door? Second one is when we play sports like basketball. The third one is when we doing the household chores. Okay, and the last one is supination. So reversely, from the pronation, pronation is when we put our hand, the palm faces downward. But when supination, the palm must will face upward. Basically, it's just like the normal anatomical position. So this supination is basically the rotating action that rotates the hand's palm upward or forward is called supination of the elbow, or more precisely, supination of the forearm. The bicep brachii and the supinator muscle help to promote this movement. So, just like all the other function in our daily life, I will give some example when we will do this supination. So, for example, when we tend to handling the object, or we want to turn the key counterclockwise. So, for example, if you want to ride a bike, you will put your key, and then you will turn. So, this is a action of supination. And the last one is like the personal care. Personal care is when like you want to apply the lotion on the underarm on the other side. You must put the lotion like this. So this is we call supination when the palm is face upward. So when we rub the lotion, so you need to make sure your elbow or your full hand is in the supination for easier to if you want to applying the lotion. So that's all the function of the functionality performance of the elbow. I will pass my next presentation to my friend Elijah for the physiology of the muscle contraction at the elbow. Thank you.
Now I'm going to talk about the events of contraction and also the relaxation in skeletal muscles. So there are the stories of this event are very long, but I'm going to summarize everything. So as you can see the image here, this is the summarization of the events um, of the contraction and also the relaxation. So first, as you can see here, the nerve cells will give the action potential, also known as the nerve action potentials, that triggers and also release the ACH, or also known as the acetylcholine. So this ACH will bind to the ACH receptors that has in the muscles to trigger the muscle action potential. So at the muscle also there is acetylcholinesterase, which is the enzymes that destroy the ACH to prevent for further muscle action potential unless there's a lot of ACH to stimulate more of the muscle action potential. So when the muscle action potential triggers, so it travels to the voltage gated calcium ion channels, where it triggers this channel to allow the calcium ion to be released into the sarcoplasm. So after the calcium ions has been released, it will bind to the troponin of the thin filament. The thin filament is also known as the actin. Then the thick filament, also known as myosin, the head of the myosin will bind to the actin, the thin filament, that causes the actin to be pulled towards the center of the sarcoma. So when it pulls towards it, it will activate the contractions. Then after the contraction, for sure there will be have a relaxation. So for the relaxation, first the calcium ions will be reduced in level, where first for the contraction will be increased level of calcium ion, but for relaxation event, the calcium ions will be decreased, and to neutralize this level, the calcium ion ATPase pump will use ATP to neutralize the level. So the trypomyosin will slide back, because first during contraction you will pull towards it, so now you going back into its own position, the original position, where it blocks the myosin binding sites of the actin. Therefore, once the the myosin binding has been blocked, therefore the relaxation events occur. I'm going to talk about the muscles that are located at the elbow and also the muscles that gives the functionality that allows the elbow to be function well. So first is the bicep brachial muscles, where this muscles is located at the anterior side of our forearm, at our arm, and for brachialis muscles also located at our anterior side of our arm. However, to be specific, it is located at the posterior of the bicep brachial muscle. Then next is the brachioradialis muscle. This muscle is located at the lateral part of our elbow and extend to almost half of our radius bone. And this muscle is categorized as isolated muscles because it is at the deep position compared to other muscles. Next is the tricep brachial muscle, where this muscle is located at the posterior of our arm, and there's a little region of it will be located at the medial side of our arm. Then next is the anconeus muscle. This muscle is categorized as isolated muscles and it located at the posterior part of our elbow. Next is the pronator teres. Pronator teres located at the anterior side of our arm and our forearm, and it is slightly inferior to the level of the anconeus muscles. Then for pronator quadratus muscle, this muscle is not located at the elbow but it is located at the distal of radius and ulnar bone. Why do I include this muscle in the list of the muscles of the elbow? Because that without pronator quadratus muscle, this muscle will not give the proper function of our forearm to be in prone or supine, because pronator teres, even though pronator teres gives the same functionality, but it needs the help from pronator quadratus to allow this rotation to occur. Then lastly, for supinator muscle, this muscle is located posterior to our forearm and inferior to our anconeus muscle. So here are the muscles that are isolated. So as you can see, first the brachialis, brachioradialis muscle, anconeus, supinator, and then pronator teres, and also lastly the pronator quadratus. So now here are the muscles that are involved for the movement of flexion, extension, and pronation, and also supination. So for the flexion is process that our arm can be bent. So the muscle incision will be at the radial tuberosity, the bicipital aponeurosis, and then ulnar tuberosity, and lastly is the coronoid process of the ulna. So here are the muscles that are related, which are the biceps brachial muscles, brachialis muscles, and lastly is the brachioradialis muscles. Next is for the extension. So for extension movement, there are two parts that is for the muscle incision, which are the olecranon of the ulna and the superior portion of the ulnar shaft. So what muscles that attach to these two anatomical parts is first the bicep brachial and the anconeus muscles. So next for the pronation. For pronation, the muscles will be inserted at the mid-lateral surface of the radius and the distal portion of the radial shaft. So like as I said, pronator teres and also pronator quadratus muscles are the muscles that in charge for the pronation. Then lastly, for the supinator, supinator will be involved for the supination movement, where for the muscle incision it will be located at the lateral surface of the proximal, 1/3 of the radius. So now I'm going to talk about the common projections of the elbow, which are the AP view and the lateral view. for the AP view, as you can see, one of the criteria is the medial epicondyle and the lateral epicondyle are located bilaterally to each other and does not superimpose to each other. Then, as you can see, the olecranon process of the ulna is located inside of the olecranon fossa of the humerus, and then the the humero-ulnar joint and the humero-radial joint are seen open. The space of it is open, which indicates that this patient or this person does not flex his elbow. If the person flex his elbow, the space of these two joints are closed. Then you can, at the elbow region, you can see there's radial head, the neck of the radius, and also the radial tubercle of the radius bone. And to know that this patient does not rotated internally or externally, we can evaluate at the radial tuberosity that the length of the radial tuberosity that superimposed to the ulna should not be more or less than 0.6 cm. And then for the lateral view, we can see the medial epicondyle and also the lateral epicondyle of the humerus are superimposed with each other. And to indicate that the lateral view of the elbow is truly lateral, we can see that there's three concentric arch, which are the trochlear sutures, trochlea, and also the capitulum, where these three structures are aligned to each other, that creates three circles that we can see on the radiograph. And then compared to the AP view, we can see that the tuberosity of the radius is not superimposed to the ulna. And at the elbow region, we can see also the radial head, the neck of radius, and also the tuberosity of the radius. And for the anachronon process of the ulna is contra to the AP view, where in the lateral view, the anachronon process is not seen inside of the anachronon fossa of the humerus. Then here are the drawings of the elbow. The first one is the AP view, and also the second one is the lateral view. So for the AP view, as I said, the medial and also the lateral epicondyle are bilateral to each other. And then as for the capitulum, capitulum should be located superior to the radius bone, and for the trochlea should be located superior to the ulnar bone. And then in the drawing part also, we can see that the radial tuberosity is superimposed to the ulnar bone, and we can see the radial head, radial neck, and radial tuberosity. And for the humerus part, there's anachronon fossa, and so on. Then for the lateral view, we can see that for the medial epicondyle and the lateral epicondyle are superimposed to each other. The anachronon process is seen not inside of the anachronon fossa of the humerus, and radial head, radial neck, and also the radial tuberosity can be seen. Then the coracoid process is of the ulna can be seen. Then the trochlear capitulum, the trochlear sutures, or the trochlear notch, and there's other part that can be seen at the lateral view of the humerus, of the elbow.